A lot of the people we talk with feel like value-based care is too good to be true, when actually it's just about breaking a cycle. It's not too good to be true, it's just not something people are used to. And the cycle that I'm talking about is when people were younger or years ago, doctors used to actually come to their homes and they would have a relationship with them and they actually knew their names and they spent time with them to understand that what their care needs were and made sure that they got better, followed up. The person had a relationship. We don't have that right now. Healthcare has kind of evolved into a process system where now, instead of the doctor coming to see us, we actually all go there and we sit in a waiting room for an hour and we sit in the second waiting room for 15 minutes and the doctor comes in and he spends 3 minutes with us, no conversation, we don't have a relationship, and what that's resulted in, believe it or not, is not very good outcomes for people health-wise. In this country, we actually spend more than any other country, and our results for people getting better are actually not even in the top 25 countries in the world. So what we're doing is not actually working. The data says we need to get back to spending more time with people and building that relationship again and actually taking care of people in a little better way. That means spending more time with you, doctors seeing less patients, and being rewarded based on you getting better instead of the way the system has been, where it's see as many people as possible. I'm sure you've experienced that. So the reason that it may sound too good to be true is because you or your spouse hasn't experienced this yet. And once you see how it impacts their health, you'll be a believer in value-based care.